Welcome to our presentation on how to save money on prescriptions. My name is Eddie Krameyer. I'm president of ABC Medicare Help. We have agents in many areas of the United States, local agents who can help you with your Medicare and help you with some of the things that we're getting ready to talk about. Question: have you ever gone to the doctor and gotten a prescription and went to get it filled and were surprised at how much it cost? The fact is that happens every day in this country, and we're going to share some ideas and concepts with you so that will never happen to you again. Have you ever fallen into the donut hole or the gap? Many people have, and we're going to share some strategies with you to prevent that from happening. We help people do three basic things. Number one, get additional Social Security income. Just recently, a husband and wife came to one of our seminars who's now getting additional $6,000 a year in Social Security income. We also help people save money on healthcare costs. There's lots of different ways we do that. We're going to talk about some of them in this presentation. We also help people get more benefits. Original Medicare doesn't cover dental and vision and hearing and things that people need, and there's ways for people to get those extra benefits at little to no cost in many situations. As independent agents, we represent all types of Medicare plans and most companies that offer them. So we can help people figure out if they should be on a Medicare supplement, if they need a drug plan, if they should be on a Medicare Advantage plan, for example. We help our clients find the plans that best fit their needs. Question: is there any drug plan that covers all drugs? Yes or no? The answer is no. Since no drug plan covers all drugs, every drug plan has a list of covered drugs. What is that list called? That's right, formulary. Formulary is just a fancy word for list of covered drugs. Does every drug plan use the same formulary? Absolutely not. Each company will have their own formulary with different medications on it, so it's very important when you shop for a Medicare drug plan to make sure that you find the plan that best covers your medicines at the best rate. In drug plans, medications are categorized by cost. What are these categories called? Drug tiers. Drug tiers determine the copays for all drugs listed on a drug plan's formulary. Most drug plans have 5 drug tiers. Tier 1 being the least expensive, Tier 5 being the most expensive. An easy way to remember it is the higher the tier, the more the tiers. What does a pharmaceutical drug rep do? They promote new prescription drugs. So this pharmaceutical drug rep goes in to see a doctor carrying a box of samples of this new high blood pressure medication, leaves a box of samples with the doctor, and then leaves. Now here comes Mrs. Smith to see the doctor. The doctor says, "Mrs. Smith, you have high blood pressure. Here's a 30-day supply of this new medication and a prescription." She goes home and starts taking the medication. Then 3 weeks later, she decides she better go to the pharmacy and get the prescription filled, and she is shocked when she finds out the medication is over $300. Does that happen? Absolutely. That happens every day in this country, and it makes me so angry because people are having to choose between medicine and groceries, and it should never be that way. So Mrs. Smith had a drug plan, but she made the most common mistake that most people make, is she did not take her formulary with her when she went to the doctor. If you're on a prescription drug plan, you should have a formulary for your drug plan. So the list of covered drugs will look something like this, and in the back of every one of them is an alphabetical list of all the medications that are covered. So what's the first question you should be asking when your doctor wants to prescribe a new medication for you? It should be, is the medication covered by my drug plan? If the answer is no, and you go to get the prescription filled, then you're going to have to pay full price for that medication. What's the second question you ought to ask when your doctor prescribes a medication? How much is the medicine going to cost? If you're on a drug plan, and let's say that your Tier 1 copay is $5 and your Tier 5 copay is $200. So if your doctor prescribes a medicine that's Tier 1, you're going to pay $5 when you get to the pharmacy, right? But if it's Tier 5, you're going to pay $200. Every formulary has sections in it for each therapeutic category. For example, all high blood pressure medicines are going to be right there together. So if a medicine is in your formulary, it'll tell you what page to turn to, and then you find that medicine on that page. It's going to tell you what the drug tier is, and you'll get to see all the other medicines in that particular therapeutic category. And when it comes to Medicare Part D drug plans, every plan is required to have a minimum of 2 drugs in each therapeutic category if there are at least 2 medicines to cover that condition. How many of you have seen the commercials on TV of the law firm saying, if you've had a loved one die from taking this medication, call and we're going to sue and get you lots of money, right? Are those lawsuits over brand name or generic drugs? The fact is they're almost always over brand name drugs. See, in order for a medication to go generic in this country, it has to be on the market for 20 years. Millions of people have taken that medication. We know the medicine is safe, but that's not the case for the new brand name drugs. If you have a choice, if there's a medication that's been around for 20 years that'll treat your condition, we know is safe, or a new medication that we really don't know, which one do you want? People who take the new medications are really being guinea pigs. That's what most people say when I ask that question. What is the chemical name for water? That's right, H2O. And it doesn't matter what it says on the label, H2O is H2O, water is water. Medications are based on a chemical formulary. The fact is, most generic medications are chemically identical to the brand name drug. But do the pharmaceutical companies want us taking generics, or do they want us take the new brand name prescriptions? The answer is obvious. They have a financial incentive for us to take the new brand name drugs. If you're taking very many medications at all, I highly recommend you get all your medications, you get your formulary, and you make an appointment with your doctor for a medicine review. And one by one, why am I taking this medication? Take your formulary. Doctor, this medicine that you're giving me is a Tier 4 medication. What about one of these other medications over here that are Tier 1? Oh yeah, we've been prescribing that one for 20 years. Well, could I take that? Of all the years that I've been doing this, I've had one lady tell me, let me tell you what my doctor does. My doctor keeps a formulary for every plan available in the area, and the first thing he does is ask you what drug plan you're on, and then pulls that formulary out to figure out what to prescribe. I'm not in any way bad-mouthing doctors. Most of them just don't understand how these formularies work. And the bottom line is, it's up to us what medicines we take. Should we listen to the doctor? Absolutely. But by taking your formulary with you, you're going to know what medicines are covered, and you'll be able to know what the cost is. So if that's an issue, you can talk to your doctor about it, okay? Original Medicare is made up of 2 parts, Part A and Part B. Question: does Original Medicare cover prescription drugs? Answer: no. Which part of Medicare covers prescription drugs? That's right, Part D covers prescription drugs. And you cannot get a Part D drug plan from the government. You can only get a Part D plan from a private insurance company. Don't get trapped into paying a lifetime penalty. When you first become eligible for Medicare, if you don't have credible prescription drug coverage and you don't enroll in a Medicare prescription Part D plan, and then later decide you want one, you're going to end up owing a penalty that you will have to pay for the rest of your life. So don't get caught having to pay that penalty. There are 2 ways to get a Part D drug plan. The first way is to stay on Original Medicare and enroll in a standalone drug plan. The other way is to actually enroll in Part C of Medicare. also known as a Medicare Advantage plan that includes Part D. So that's a Medicare Advantage plan with drug coverage. Many Medicare beneficiaries are choosing Medicare Advantage plans for their Medicare coverage because of the extra benefits. In many counties, there are Medicare Advantage plans that have dental benefits, vision benefits, hearing benefits. Some of them have gym membership. Some of them have over-the-counter benefits. I want to encourage you, if you've not already done so, to watch the on-demand webinar on how to compare Medicare plans that is on our website. If you or someone you know has limited income, you may be one of over 1 million people in this country who qualify for extra help and are unaware of it. One of those programs is called the Prescription Drug Extra Help Program. This program is through Social Security. My mom was on this program before she passed away. If the doctor prescribed my mom a medicine that was $1,000, my mom usually paid no more than $3 for that medication. And there are more than 1 million people in America that qualify for the Extra Help program that don't even know it. Another program is called the Medicare Savings Program, which will actually pay a person's Part B of Medicare premium. I had a man come up to me after one of our seminars and he said, "Eddie, can you help me cancel my Medicare?" And I said, "Why?" He said, "I make $700 a month. They're taking out over $100 for Part B for Medicare out of my Social Security check, and I can't live." And I said, "Would it be okay with you if we got the state to pay that premium for you?" And we did, by helping him get enrolled in the Medicare Savings Program. Many people also qualify for Medicaid, and people who have Medicare and Medicaid will pay little to no medical expense. In fact, people who have both Medicare and Medicaid may qualify for a special type of an advantage plan called a dual eligible plan, and these plans are available in many counties with just incredible extra benefits with dental and vision and hearing and things like that. If you or someone you know has limited Social Security income, you may qualify for additional income. For example, if you knew somebody who's only getting $400 a month in Social Security and they have limited other resources, with one phone call, we can usually get them a $4,000 a year pay raise. There's so many different ways that we can help people that most people are not aware of. Our agents can help make Medicare simple for you, can analyze your current situation, help you choose and find affordable coverage. See, most agents who do Medicare work for one company, and they always want you to enroll in their company. Our agents are independent agents. They represent all types of Medicare plans and most companies that offer them, so we can help people figure out what plan will be working best for them. Our agents can also help you avoid costly mistakes and save you time and money. You don't have to do this alone. We are here to help. Our agents help thousands of people every year navigate this confusing maze of Medicare. You know, sometimes plans don't follow the rules. They don't do what they're supposed to do. And it's so important to have an agent who can go to bat for you, and we don't charge a fee for our services. I want to encourage you to request a free, no obligation consultation with one of our licensed and certified agents. To do so, click over here. I hope you give us a thumbs up on the video. Please subscribe so you'll get future videos. God bless you, and I hope you have an incredibly awesome day.